Hello, everyone. I'm happy to be back. This time I have somebody who is a future public health professional. She's quite qualified already. But anyway, let us listen to her tell us what she does. Right now we have with us Dr. Prayukta Sinha. Let's listen to her. Over to you, doctor.
Good day, everyone. I am Dr. Prayukta Sinha. I am from Malda, West Bengal, India. First of all, before saying anything, I'd like to express my deepest gratitude towards Dr. Subodh Mathur for giving us a safe space to speak our hearts out. Sir, you're a great source of inspiration. Now, coming back to me, I am a homeopathic doctor by training and currently pursuing my Master of Public Health at the Indian Institute of Public Health, Gandhinagar, Gujarat. Then I've done my schooling, secondary and higher secondary, both from Kota, Rajasthan. Then I successfully qualified NEET and did my Bachelor of Homeopathic Medicine and Surgery and completed my 1 year rotational internship in my medical college hospital and which ended this March 2024. So my interests are singing, dancing, reading, and traveling. Also, due to my exceptional result in Standard 10th, I was felicitated by the Times of India and the Ministry of Education as well. I was felicitated by various institutes for ranking second in my college among 60 students. And currently, I hold certifications from esteemed organizations like WHO, UNICEF, and HSRC. So that's about me.
Tell us more. What were all these? Why did you choose the field that you chose? These awards, what do they mean? What are they? So let's tell us more.
Yeah. So, so an obvious question might arise that being a doctor, why did I choose public health? Why not sit in a classical setting and abide by the rules of society or what professional roles I am to follow? Well, during my internship days, I came to realize that sitting in a 9 to 5 setting in a hospital, treating patients rigorously, is not what I had in mind for myself. I was searching for that sense of fulfillment inside me. I wanted to do something for the community. I wanted to do something that will bring about a change in the society. And being a physician, I can serve the community at an individual level, I would say. But being a public health professional would enable me to widen my horizons and serve people at a community level. And hence, it would have a larger impact on the society. Also, I would like to add that I have a personal reason as well that I lost my father to the monster pandemic. And I believe that struck a nerve in me that we, as educated people living in urban areas, have such limited knowledge about a basic tool like vaccines. Then, what about people living in the remote areas? They have no knowledge about it, they know nothing about it. So, I believe that I didn't choose public health chose me. So yeah, that is my main motivation towards pursuing this field, I believe, and not the classical setting of being a doctor, opening a clinic and stuff like that.
Okay, well, you are the first person here who's a homeopathic certified doctor. Tell us what
Yeah.
it is like, how are the courses, what do you study, and what do most people do afterwards?
Okay, so homeopathy, as we call it in India, it is an alternative kind of medical study. There are like MBBS person who study MBBS. There is Ayush system of medicine where Ayurveda, yoga, Unani, and Siddha, homeopathy, these things come. So homeopathy it is originated from Germany, and the founder of homeopathy is Dr. Samuel Hahnemann. And here we treat patients from the core, like we focus more on the curative aspect and we treat patients from the core rather than just palliative care. So that is what homeopathy is. And in short, we just don't provide like situations, like we don't provide solutions for now, but we provide solutions for the longer run. Yeah.
So could you give an example?
Like if somebody has a skin disease, we believe that there is a prior cause to that. And we tend to find that prior cause and treat that cause itself. And hence, the skin disease will suffice itself, and not just the skin disease. Whereas if you go to a dermatologist, it might be a ready solution, like
mm,
it can act within 2 days,
mm.
but it will suffice again if you stop using that ointment, if you stop using that medicine. But in homeopathy, if you start taking that medicine as of now, it might take 1 month, 2 months, but it will surely get cured in that.
Mm.
So, yeah.
So it is actually, as you said, a Western form of medicine which we have accepted in India. It
Yes,
is not
absolutely.
indigenous to us. It came, as you said,
No,
from Germany,
from
but it's
Germany.
now
Yeah.
widely practiced in India, right?
Yes, it is well accepted, I would say.
And perhaps more than in Germany.
Yeah, absolutely.
Yeah. Okay.
Yeah,
Uh,
absolutely. Like
okay. So,
I find children and elderly always taking homeopathic medicines around me.
mm,
Whenever I say that I'm a homeopathic doctor, they tend to ask me
mm,
that, okay, tell me a medicine for this and that.
mm,
Yeah,
mm.
so I
Okay.
would say it's very accepted.
Are the medicines regulated and safe, or are they still locally made? How is it in medicine?
No, they are safe if you take that under the supervision of a physician.
Okay.
So you should not take, like, in homeopathy, there's a common practice that people tend to take medicines without even asking the physician, and they say we practice homeopathy. So that is a very, like, unaccepted term for us physicians, that you shouldn't do that. You do not take antibiotics without
So,
asking a physician. Then why this?
okay. Now, recently, what recently, in the last 15, 20 years in
Yeah,
India, we have so many diseases which we can call as lifestyle diseases.
yeah.
Does homeopathy have any opinion on that and any solution?
Sir, I think that your question itself answers that it is a lifestyle disease.
Yes.
So if you modify your lifestyle, it
Yes.
the disease will automatically suffice up to an extent. And of course, in lifestyle diseases, homeopathy provides shorter solutions, because if you do not work on yourself and if you rely on medicines only, that's not the solution for anything. You need to have that mentality that yes, I want to change. I want some change in my body and my mind. Then only the medicine can work. So yeah.
Again, can you give us an example?
Like if you say somebody is obese, and somebody goes to the physician and say that give me a medicine for becoming thin or for skinny. So it's not how it works. Even allopathic medicine cannot provide you the solution unless and until you modify your diet, unless and until you start exercising. So if you do that, along with that, you can take some kind of medicines. Of course, there are solutions, but they can only help you, not change your entire disease as well. Yeah.
All right. And now turning to public health, you said
Yeah.
that you are more interested in serving the community. So what
Yes.
exactly is your interest? Public health is such a big field. Do you already have some narrower field in mind, or right now you are just learning?
As of now, I'm still exploring, sir. And all like, yes, I have a field in mind, but I would say that it's very early in my career to say so.
Yeah.
And of course, I want to go into research and I want to do something that will bring change in the society.
Hmm.
But there are a lot of issues which are unaddressed.
Mhm. Like
And
what?
in the future,
Let's have some
yeah,
examples.
yes, okay. So, health accessibility in India is a leading issue. Why the main problems arise? Like, health accessible healthcare is available in tier 2 or tier 3 cities with amazing state of the art facilities, but it is actually accessible to the middle class or the poor vulnerable of India. So it's not that accessible. They still tend to go to the places where primary healthcare system is available, and they're like the government operated ones, and they do not have that kind of facilities. So there are several solutions to it as well, but as a country, we are still trying to cope up with that. Also, like, there are initiatives by the government as well, and I believe the main issue with that is there are policies but they are not well implemented. Like, health communication and awareness is a big barrier, I believe. Like, there are policies but people do not know about them.
Okay.
People are not aware that they can avail uh, this policy, they can avail this services,
Hmm.
and there comes a barrier in the healthcare professional and the people of uh, the normal people of our country. Yeah.
All right. Now, you may not have an answer to this question, but let me ask it anyway.
Okay.
Do you see any difference between men and women in this public health field?
Absolutely, sir. Public health, as I said, that public health is a vast area. And as someone who has worked in the World Bank himself, you can say that how poverty affects healthcare, and how health is affected by poverty and poverty is affected by health, vice versa. So poverty in our country is a very big, it plays a very big role. And poverty for men and poverty for women are very different. Poverty for men, I would say that they tend to hide it. They'll say, yeah, yeah, everything is fine with me. They'll not share it with the family. And the women, they'll eat just one chapati and then they'll give it to the rest of the family. And they'll say, yes, mera pet bhar gaya hai. So I believe men and women are equally affected and also not equally affected by these type of scenarios like poverty. And public health, of course, works around them, with them.
Hmm.
Also, like a main area of public health includes reproductive and child health. So I would like to address that menstrual hygiene and menstrual practices, these are very, it's a big taboo in India. So I would say thanks to the Western culture now that we are starting to talk about it a little bit more, and we are being open about it. And if we go back 10 years or 20 years, we did not talk about it in front of the male members of the family, and hence have a larger health related issues regarding menstrual hygiene and menstrual practices. So that would create a burden of disease, I believe.
There have been at least three young women in my Vidpeds
Yeah.
who have said, we want to do something about this. And they have done something about it in their college days.
Okay.
They formed some group or society or something. And at least one said, I'm still continuing with it, even though I'm not in college anymore.
Okay.
Do you think that this problem can be partly addressed by non-profit groups, or do you think it's the government's job?
No, sir, I believe that everybody in the country or everybody in the world, I would say, should be aware, be it whatever gender, be it whatever uh, sex they are born with. They should know about it, the right procedures, and how to address it. Like, if, like, you should create that safe space that one girl can come to you and
Hmm.
tell about the problems.
Hmm. So
We as women do not want anything more than acceptance.
I had posed this issue on
Yeah.
LinkedIn that
Okay.
a very broad question that, it's my ignorance. So please tell me what's happening. And one IAS officer from UP wrote that indeed we are giving attention to girls. I think from ninth standard onwards in school, we are talking about these issues. And, not we, meaning, of course, the teachers. The teachers
Yeah.
don't discuss it with the female students. They don't discuss it with the male students, obviously. India has not yet gone that direction. But he said it's pretty serious. We take it seriously. And so we tell them about these issues in the school. That's what he wrote. So that's fine.
Okay.
Why would he lie to me? Right? He wouldn't lie to me. But do you think
Yeah.
that's enough, or do you think there's something more that needs to happen?
Yes, definitely there is more that we need to do, because the first taboo, I would say, arise in the school itself, the problem you stated, that why to exclude guys from it, why to exclude men from it. They should also know, they also have women in their house. They also, without, because without them a society cannot perform. So I believe that without men and women a society cannot be completed. And they should also be aware of what is going around them, why a woman is behaving in a certain manner, what is the problem behind it. And it is not only the school's job to teach, you should also practice it in the family, you should also practice it at your own home. So yeah,
But that,
there's yet a lot to do
okay, that's the
in this
question of,
area.
as you rightly said, awareness, acceptance. But is there also an issue of cost here, economic issue?
About what, sir?
You know, the cost of buying tampons and all these things, is that also an issue?
So even government provides free pads for them, or I would say at a low cost, pads at a very low cost. So people who are economically weaker can avail to those services as well. And later on, they can, their family members, if the parents would know about the issues, the health hazards, by using dirty clothes or by using low quality pads, they would themselves buy them newer pads or well equipped things for their menstrual hygiene, I believe.
What
And
these,
if not,
go
and
ahead.
if not, the government provides solutions to that as well. That they provide very low cost pads in the
But
Jan Arogya Mandirs and stuff like that.
what these three or four young women have said that they found from their surveys and their work that there's still a big need, that they are trying to
Yeah.
provide low cost, good quality tampons and
Yes.
pads and all, and they're still trying to distribute. So whatever the government is doing, it doesn't seem to be enough. I mean, I don't know. Okay, I live far from
Yeah.
India, so I won't know. But what I'm saying is this: what I've heard from responsible young women, and I'm just asking you, as a public health expert. Those people are not experts, but you're going to be. So, what is the actual ground reality?
Yes, definitely, sir. There is a lot to be done from the government's front as well.
Okay,
Like a lot to do from
okay.
their side as well.
Now, you mentioned
Definitely.
that people go to the primary health center.
Yeah.
Do they have these facilities? Can a woman go there and say, tell me about it or give me something, or is that not a common practice?
Sir, then again, you need to find the right person for it. If you go to an ASHA worker or an Anganwadi worker or the physician there, they'll definitely tell you about it. But
Mhm.
if you go to a cleaning staff, they might not tell you because they themselves don't know the ground reality of it.
Okay,
They themselves treat it as a taboo.
okay, fine.
So
All right.
you,
We have talked quite a bit about this. Can we talk about
yes.
something else on your mind?
Okay. So, uh, what I would like to ask you a question. Like, as I've seen on your LinkedIn that you've worked with World Bank. So, how do you think that economics of the country has affected healthcare?
Well, okay. We have to look at it from the demand side and the supply side. And
Okay.
I think uh, certainly the demand is very high, but demand in an abstract sense. But actually, the working money is not there with many people. The affordability issue, the money is not there. So the government has made, both the state and the union government have made a lot of efforts. But I think
Mm.
that health is a state subject.
Absolutely.
And we should think more and more about what the state is doing. And you are from Kota. I've heard that Rajasthan is better at healthcare than many other states.
No, sir. I did my schooling from Rajasthan and I'm from West Bengal.
Okay, so but you did your schooling in Rajasthan.
Yes,
So you might have
absolutely, sir.
some idea of how the healthcare in Rajasthan is. So the question in my mind is that where is the accountability? Where is the responsibility and where is the accountability? I think Delhi is too far.
Yeah, exactly.
Delhi is too
Absolutely,
far,
sir.
to expect that they understand in Delhi what is happening in the primary health centers across India. This is unrealistic. We
Absolutely,
we
sir.
need to
And
move. Yeah, sorry, go ahead.
no, 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 sir. Please
So
continue.
we need to move to a understanding that this is the job of the chief minister. And
Yes.
if the chief minister says, I don't have enough funds, which may be the case because our system of dividing funds between union and state governments, and I don't want to go into that because it's a very complicated issue and it will take hours. But
Yeah.
suppose that the chief minister says, listen, I don't have enough money in my budget and I still want to achieve.
Yeah.
Then the chief minister should be able to tap into the younger people of his or her state and say, listen, this is what we can do, X, but we also need Y,
Yeah.
right? Clearly make it known that this is X, this is the money we have, this is what we can do. Instead of having this old my bap attitude, Sarkar is my bap, Sarkar will do everything. You can say honestly and clearly that, listen, we don't have enough money because the complicated formulas are there. Nobody cares about those formulas on the ground. What you want to
Yeah.
know is, listen, in the primary health center, we can only do so much, right?
Yes.
And now, can you other people organize and do something, which we will give you a list
Yeah.
that this is what we cannot do, but this is a high priority item, right? And can we organize, this is my idea,
Yeah.
can we
Absolutely.
organize a non-profit lead agency for a state?
Yeah.
Not the government doesn't
We
organize.
want.
We have
Yeah.
a All India
There are
organization.
several NGOs, but there is not one leading agency which
Not, we don't need one
oversees.
leading,
Yeah.
we can have two or three,
Yeah.
right? We can have, it's not a monopoly situation. We can have two or three, and they can all have their own agendas, but then they should be working for a cause or a system that has been understood and debated and agreed to, that listen, this is what is needed in those centers. Like we have in
Yeah.
education now, people are setting up private universities, right?
Yes.
And people are setting up even private schools. Well, they are not, they are somewhat subsidized.
Yeah.
We need to
Private
get
schools.
into the villages modern, subsidized NGO care,
Yes.
right?
We need
And
more NGOs which would provide the solutions at a less cheaper cost than private
and
ones.
the
Yeah.
reason I'm saying it is because I've heard all of these people say, oh, while I'm in college, I would like to do something, I did something, but it's all random.
Yes.
There is no organization behind it. But there should be something that says, okay, uh, we are going to do this, say, in your state, West Bengal. Okay, we're going to do
Yeah.
it in West Bengal. And then if you are in the colleges of Delhi, Asansol, Durgapur, uh, Siliguri, all these big cities, fine.
Yeah.
You can take, in the summer, you can go and do this. It's like an
Yes.
internship. Okay.
Yeah.
Right.
That
Okay.
would be very helpful for
Do
the
this in the
receivers and
summer.
as well.
Uh,
Yeah.
or even in the, because summer is field possible. If you say it's hot and all, it's okay, fine. You are not interested, don't do it. But
Yeah.
those who are interested, those who are willing, those who, okay. So we need, what I'm saying is that we need a way to
Yeah,
channel the energies of the young Indians. And let me tell you,
absolutely.
I've heard 500 or more. Nobody else has heard 500 people. Honestly,
Exactly.
for
Yeah,
40 minutes,
absolutely.
nobody. I am the only person who can say, teachers listen to the students 5 minutes. I'm
Yeah,
listening to you for a long time. I listen. So I can say that there is enough energy in young people.
absolutely.
And we
And with
need to form a channel by which they can go out during the time when they have the energy and the freedom to do something. Okay. So if
yes,
you have a
and with
system,
the
yeah, you have a
and with the
system.
leading amount of like youngsters coming into the field of public health as well, they want to do something, and
You
we
want
should
to do.
channelize that energy.
Yeah, no,
Absolutely.
I'm saying channelize of all young people. You are in
Yeah,
university or college X in Durgapur. Okay, fine. In Durgapur, we have a agency. You can take whatever you want to call it, internship, professional experience, field work, and I don't care. But we have a plan that we are
yeah,
providing this, and you can do X. Please come. And year after year, you come. Next batch. So I think
yeah.
we need a plan to organize the young people, because I think the governments have reached the limit of what they can do. And I'm not being against any party. In all parties now, there's too much focus on just winning the next election and on fighting all the time in public with each other on issues that don't change anybody's life.
And health is never an issue
No.
over which an election has been won.
Yeah.
Health is never an issue. Only
There is
religion could be an issue.
there's
Yeah.
an election which was lost because Sanjay Gandhi enforced family planning.
Oh,
Too
yes.
long ago in 1976,
Yes.
1977,
Yeah.
and Indira Gandhi lost because of the forced family planning,
Me planning. Yes, sir.
right? So, but I forget those days. What I'm saying is that people like you who are in public health, you are young, hardworking, motivated, and you want to serve the community. One way would be to organize a system by
Yeah.
which young people who are not experts, but who are motivated and enthusiastic, and maybe you give them a 1 week video training. Okay, fine. Sit on the Zoom call, WhatsApp video. We give you 1 week training. You go out, and then for 3 months, 6 months, 1 year, you do this.
Yes.
Okay? Now, I'll give you an example.
Yeah. Sure.
There is an NGO with the initials FEA, Freedom
Okay.
Employability Agency. They are giving soft skill free treatment in India to young people who are very hardworking and motivated but couldn't get a good education because they don't have the money. Okay. So, but they still want to do well, and so they are training, helping them. That is direct help, right? But
Yes.
then what they do is that they ask other people, seniors, to have video sessions with them, 5 video sessions with a group.
Yeah.
Okay. I am one of those people. So we talk to them, we explain to them what they do, what answer their questions because they have nobody to ask. We answer
Yeah.
their questions, we give them
Absolutely.
some suggestions, we give them some advice, but most important, we want to give them some sense of confidence. Okay. Now, the
Absolutely.
NGO itself didn't have this, but my friend and I, we started asking young people to join us. So I am the chief, but I
Yeah.
have several young people with me. So they are also, I say, yeah, you are young. They are young. Who am I? 70-year-old man. So you come with me. So they sit with us in the session. It's all by video. So you can sit
Yeah.
on it from any country.
Okay.
Okay. There's no.
That's a great initiative, I would say,
So we
as you
have
said.
successfully introduced a system by which the young people second year BA. And the
Okay.
FGO people complained, oh, you're putting these young people, they are not good enough, they are not. I said, stop it. Those people are their age. They can talk directly to them. They don't
Yes.
bother us anymore. The CEO also said, okay, do it. They are enrolling 65,000 students a year. It's huge. They don't charge a
Yeah.
paisa, 65,000 a year. It's like bigger than a university. But,
Yeah, absolutely.
but now we tell them that, look, so, and some of the, especially we see that the girls are a little bit patriarchally suffering.
Yeah.
And we can't help them because we are too old. They don't, our gut reaction, their gut reaction is, hey, no, no, I can't trust this guy. So
Yeah.
that's why we started the practice of bringing in especially college girls. And some of those girls are now older, but for 3 or 4 years, they come into the video meetings and they listen to those young girls. And by now they're practiced. They say, oh, if they ask this question, this is, and you tell your own personal story and you empowered them.
Yeah.
So this is one practice that we introduced against resistance from the authorities in the FEO. They do a great work, but we said, look, you don't understand that these girls are different from these boys.
Exactly.
They're different. And they're different, but that means that old people like me and my friend, we don't have a gut connection to them. We,
Also, girls could very well connect to the vulnerable population as well,
so they do. So
like
we are
women
saying
and
that,
children.
look,
Yeah.
we have set up this system. So look, and every time we are looking who can, we also have some senior women. Right? So what I'm saying is that it will be possible for a enterprising person like you to set it up once you are in the future. Think about it now, set it up that, look, there is no cost. This is just video.
Yeah.
But menstrual issues can be discussed in video.
Absolutely.
If it's only
Menstrual education can be given over videos as
if
well.
you are doing it only all girls, there is no
Yeah.
problem. They can just be at home. You don't even have to have.
Yeah.
In the pandemic, we used to do that at home. No need for a school room. No need to let them go out anywhere. So we have modern technology now,
Yes.
right? So
I
the
agree. I
girls can
absolutely
say
agree.
they take the phone from the parents for 1 hour. It's not a
Yeah.
problem, you know. We are going down to not the ruralist, maybe not to the deep rural, but you can go
Yeah.
down to tier 2, tier 3, and you can say, listen, it's only girls, and we have a respectable lady with us, so you are confident that we are not trying to cheat you or whatever, local person.
Yeah.
And you organize it and you say, listen, this is what we want. You have any questions, you have any issues, you have any help, how can we help you? Let them talk, let them ask, not so much teach. Let them talk.
Yeah.
This is what I'm doing in Vidped. You talk, I listen.
Yeah. Absolutely.
So you do that. That
Yeah.
they
I
they
believe
ask.
that's a great idea. Yeah.
So
To
think
bring
about
women
it and
forward.
start organizing it right now in your mind that we can
Yeah.
have a low cost method.
Yeah.
Because the
True.
technology has gone, we have to agree that the technology has gone to these places. They don't need
Yes.
their own,
Absolutely.
they don't need their own cell phone. They are not going to work on it for hours. They just
Hmm.
need maybe at 7 p.m., 8 p.m. for half an hour,
Yeah.
1 hour, and you can have it. There's no time date. You can have it today, tomorrow, any day. Set it
Yeah.
up. Set it up. It's a
That's a
low cost.
great idea, sir. I would definitely think about that.
And,
That's a
so,
great
and
idea. Yeah.
organize the local students. And it's not just for girls, for boys also. What is the
Yeah. As well.
issue?
Yeah.
They can also come. Maybe there's a separate session culturally. I don't know. I don't speak to culture. I'm saying you
Yeah.
organize it maybe in one district. Start
Yes.
from one
Absolutely.
district. Pick one district anywhere and say, listen, we are going to get some money. We're going to set it up. It's very low cost because all the experts are at their homes. They just need a cell phone, which everybody has.
Yeah.
They need a connection, which everybody has. Let us not waste money. Let us not spend costs. let us just organize it all on video. And curriculum, you set it up. So in short,
Yeah.
I've already talked a lot. That's my answer.
Yeah, absolutely. So it's a great idea, and I would definitely think about it. Like when I want to do something, so this would be a great thing to start with. Everything.
Okay. All right. But
Yeah.
please tell us more about what you are doing. It's not my place to talk here.
As of now, I am studying, and also I'm working on a few projects as well. One of my research topics. And currently, as I said, I'm still exploring all the options, and I'm not really sure about which direction of public health I want to go in. But yeah, I'm still exploring. I'm still learning a lot from the professors here. They are amazing and all have wonderful research papers and stuff. Everything is like really well here.
Okay, wonderful. Anything else you want
Yeah.
to add here?
No, as of now, that's from my side, I believe.
Okay, fine. Thank you so
Anything.
much for being here and sharing
Yeah,
with us your
it was a
experience.
delight talking to you, sir. It was a
Okay,
delight.
fine. Let's end it here and we can talk a
Yeah.
little bit offline. All right. Thank you so
Yes.
much,
Thank
Prayukta.
you so
It was great to hear from you.